Hello everyone, my name is Jasmine and today I will be teaching you about a total hip arthroplasty. Before we begin, I would like to go over the outlines, objectives, and points that we will be discussing during this presentation, starting off with the definition of a total hip arthroplasty, followed by the history and development, benefits versus risks, effectiveness and outcomes, and reasonings as to why a patient would need this type of procedure. I'm going to show you a few statistics on the procedure, and then I'm going to take you to meet the surgical team, discuss the prosthetics, equipment, and instruments used during the procedure, and a full breakdown of the surgery experience, including the pre-op, post-op, and recovery, and what to expect when you enter the OR. A total hip arthroplasty, or also known as a total hip replacement, which is often what it is referred to as, is a surgical procedure in which the hip joint is replaced with a prosthetic implant due to worn or damaged bone and/or cartilage. As you can see on this slide here, the highlighted yellow area is your hip joint. This includes the femoral head, and the acetabulum, which is on the pelvic bone. Your hip joint is considered a ball and socket joint, which we'll get more in depth in a little later. Looking at the history and development of a total hip arthroplasty takes us back to 1891, where the earliest recorded attempt at a hip replacement was done in Germany by Professor Gluck. He was the first to present the use of ivory for the hip replacement procedure. During this time, it was a common procedure for patients whose hip joints were being destroyed by diseases such as tuberculosis. In 1925, the glass mold created by Dr. Smith Peterson entailed a hollow hemisphere that fit over the femoral head, making a smooth surface for movement. Unfortunately, the material failed to endure the forces created at the hip joint. Later, a trial of stainless steel, which is the current material of choice, was fitted into bone with bolts and screws. By 1953, Dr. McGee began by using a cemented prosthetic known as the Thompson stem and replaced the acetabulum with a chrome socket. Together, these prosthetics showed a survival rate of 74% over the span of 28 years. Although Dr. McGee's alterations had good outcomes, the method became unpopular as the mid-1970s approached due to visible effects from the metal particles during revision surgery. In the 1960s, the low-friction arthroplasty, designed by Dr. Sir Charnley, consisted of three parts: a metal femoral stem, polyethylene acetabular component, and an acrylic bone cement, all of which are indistinguishable to what is used in today's hip replacement procedures. Today, techniques are now standardized. However, the variety of techniques that are currently being used are an attempt to find the combination of material that carries the fewest complications. For example, metal on metal, metal on polyethylene, or ceramic on ceramic. So now that we've gone into the history of the total hip arthroplasty, let's go into why a patient may need a procedure like this. Well, conditions such as osteoarthritis, rheumatoid arthritis, or even osteonecrosis could warrant necessary surgery due to the effects that the conditions have on the joints. Patients that don't have these conditions but have symptoms of hip pain that is persistent or worsening over time, that interferes with their daily living and affects the ability to bear weight, or even makes repositioning difficult, lying down, sitting down, all of the above. If this patient were to consult with an orthopedic surgeon, they may be deemed a great candidate for a total hip arthroplasty. So as a patient, you've consulted with your orthopedic surgeon and have been deemed a good candidate for the total hip replacement. But you want to know the benefits and the risks. What's the worst that could happen? And how is it going to help you? Let's go over the benefits. It can bring a great reduction of pain to the area. It can increase mobility and strength, reduce risks of worsening chronic health conditions, like we talked about earlier, the osteoarthritis and the rheumatoid arthritis. It can improve coordination. So if you have an elderly patient who has become frequent with falling, having a hip replacement may improve the coordination, thus preventing further falls. And it gives the ability to maintain a healthy and active lifestyle. The risks, like any risks with a procedure, can come with the formation of blood clots and surgical site infection. Being an orthopedic patient, there are a lot of specialty instruments used, such as mallets, that could cause further fracturing during the surgery, but those can be addressed during the surgery by your surgeon. Postoperative dislocations, loosening of the prosthesis if your bone does not overgrow it and hold that socket in place, it could loosen up. Nerve damage, change in leg length has been noticed by some patients, and the possible need for additional surgeries. Okay, let's talk numbers. Over 1 million people in America undergo a total hip replacement every year. In 2010, 1,231,209 people under the age of 70 received a total hip replacement. And also in 2010, 1,321,606 patients ages 70 and older received a total hip replacement. Of those patients, those that were rechecked after 10 years post-op had a 95% survival rate of the prosthetic implant, and those after 20 years post-op had an 85% survival rate of the prosthetic implant. Next, I'd like to take you to meet your surgical team and specialists who will be taking care of you before, during, and after your surgery. First is your orthopedic surgeon, who will be accompanied by an assistant, whether it be a physician assistant, nurse practitioner, or a surgical first assist, your anesthesiologist, your surgical technologists, your PACU or post-anesthesia care unit nurses and staff, your surgical nurses, and your physical therapist and occupational therapist. All of these people will be on your journey pre-op, perioperative, and post-operative. Okay, I know this is the part you all have been waiting for, so let's talk prosthesis. During a total hip replacement, the damaged joint is replaced with artificial parts that are comprised of two components. One is the ceramic ball that attaches to the metal stem, which is then inserted into the femur for stability. And then two is the metal cup that also has an inner plastic layer that attaches to the socket part of the hip joint called the acetabulum. If you see here, the picture on the far left breaks down each of the components of the prosthesis. So you'll see your cup, which is the part that goes into the acetabulum, the cup liner, which is the basically like the sticky holdy part for the head of the femoral stem. And then you see the stem there that is actually inserted into the long portion, the shaft portion of the femur. In the picture on the far right, it will show you how the bone is prepared and then how the prosthesis is inserted to give you a new hip joint. Although the prosthetics are the most important pieces of this surgery, there's also a plethora of operative equipment and specialty instruments that are used in the operating room. All of these are included but not limited to bolts, screws, pins, plates, bone cement, tourniquets. Your surgeon may use radiology imaging devices such as an X-ray to ensure the placement is correct. Your general anesthesia unit. Your surgeon may use a mallet, retractors, drills, pliers, all of these things to help your surgeon give you the best surgical experience. Okay, so as a patient, you've met your surgical team, you know what prosthesis you're going to be using. It is time to prepare for your surgery, and this is what to expect during your pre-op. Once a surgery date is set, you'll begin your preoperative prep, which includes getting a medical evaluation by your primary care physician, which includes blood work, EKG testing, stress tests, a chest x-ray, and urine samples. All of these things will tell your surgeon if your body is healthy enough to undergo the procedure. On surgery day, you may be asked health history questions such as if you have any advance directives like a medical power of attorney, living well, or a DNR. They'll ask about any dietary restrictions or allergies to medications. They'll want to know all of your current medical conditions and what medications you are actively taking, including supplements. They'll also want to know any prior surgeries for your health history. In case of any excessive blood loss during the procedure, your surgical team may request that you donate blood prior to the surgery to ensure you have an option for restorative measures. Also, excess weight can increase the risk of infection or other complications during surgery, so your surgeon may request for you to increase healthy eating habits and promote daily exercise in the months, weeks, or days leading up to your surgery. Congratulations, you've made it to surgery day. Here's a quick breakdown on what to expect when you enter the operating room. Step 1 will be to enter your IV line. Once you're taken to the operating room, you'll be hooked up with an IV line and possibly have a urinary catheter inserted for the duration of the surgery. Step 2 is anesthesia. You may receive one of two types for this procedure. One is general anesthesia, which puts the whole body to sleep, or two is an epidural nerve block, which numbs everything below your umbilical region. Step 3 is the initial cut. You'll be positioned to allow access to the hip joint. Then your surgeon will create the first cut to begin your surgery. Step 4, prosthesis. Your surgeon will remove the head of the femur or the ball part of the joint and then create an opening through the center of the femur to hold the stem of the ball prosthesis. Step 5, prosthesis. Your surgeon will then remove the damaged bone or cartilage out of the acetabulum or the socket part of the pelvic bone and attach the cup prosthesis. Step 6, movement. Once the prosthesis is in place, your surgeon will rotate your hip to ensure your range of motion works correctly with your new hip joint. Step 7, close. Once everything is in place, your surgeon will suture the subcutaneous layers of tissue back together, but the outermost layer of skin is usually closed with surgical glue. Step 8, PACU. Once the surgery is complete, you'll be taken to the post-anesthesia care unit where you will be monitored for any possible post-surgery complications. All right, you've made it out of surgery safe and sound, and now you're on to your post-operative journey. Post-op care begins once you're out of surgery. Your post-operative team will encourage you to be active and to move around as soon as possible. Usually, patients will be discharged once they're able to walk, climb stairs, and change positions from sitting to standing independently. Some patients may spend time in an inpatient rehabilitation unit to prepare for independent living at home, but all patients will attend physical therapy for several weeks until muscle strength and range of motion is regained. Now that you've been discharged from the hospital, your recovery process begins. It's recommended that you ensure your surgical site stays clean and dry, and you take all medications prescribed to you as directed by your surgeon. Keep and attend all follow-up appointments, and attend your physical therapy and occupational therapy sessions. Also, work on the at-home exercises as directed by your surgeon and physical therapists. You're able to keep your legs slightly elevated to control any swelling and use intermittent ice therapy on the surgical site to control swelling as well. You will be discharged with any type of post-surgical instructions to take home with you and refer back to. Just remember, every body is different and every person will recover differently. It's usually recommended to wait 10 to 12 weeks before returning to work or adding light activity. Patients should be able to return to regular activities of daily living between 3 to 6 months after the surgery. Beware, Post-op blues is a common emotion that patients may encounter after the surgery when there's no visible healing progress. It's imperative that the patient keep a positive attitude and a support group such as family and friends to keep spirits high and healing on track. Thank you so much for visiting my presentation on a total hip arthroplasty. If you have any questions, please feel free to leave them in the comments below. And as always, stay hip, stay groovy, and we'll talk next time.